Good afternoon, everybody. Welcome to It's Worth a Shot. We're just going to give a couple more moments for people to get in here from the lobby, and then we'll start the presentation today. Okay, looks like we got most everybody. So today's Worth a Shot, we're going to continue on with some phase 3 updates with Julie Jensen from Alaska. Let's go to the next slide, please. As always, we want to thank all of you for participation in the webinar, and also all of our guest speakers for collaborating with us and also lending their time and their knowledge to us. We really appreciate that. Next slide, please. Just want to remind you that if you have any topics or any information that's timely that you'd like us to discuss on this webinar, please put them in chat. We do conduct these every Wednesday. And then I do want to give advance notice. We are not going to have a webinar on December 28th due to the break in between the holidays. We figure a lot of people will be on vacation or have some time off to enjoy the family and the holidays. So again, there will be no webinar on December 28th. But we will have them through the rest of December. And also Mary will be putting I can never remember what they're called. So we have a poll question for everybody. Let me go ahead and read that for you. Have you completed initial flu vaccination efforts at your center? So if you could just answer that yes or no, really appreciate it. And then survey, yes, so Mary's going to put a survey in the chat for you to fill out. And if you could fill that out, we'd really appreciate that. We'll give this a couple more moments. All right, looks like the majority have completed their initial flu efforts in the center, so we really appreciate that. Let's go ahead and end the poll, Mary. And then we're going to move to the next slide. I'm going to pass it over to Kyla to go over the most recent influenza snapshot.
Thanks, Miranda, and I'm glad to see that most of you folks have done your initial flu vaccines, because we are really seeing an increase this week across the country. This week, we saw a 14.7% positivity rate in influenza tests. And we are also seeing some other kind of early alarming kind of warning signs is that this is going to be a pretty bad flu season. The majority that we're seeing is H3N2. That's the influenza A. And then we're also starting to see a little bit of H1N1. There's been 2 more pediatric deaths, so that's bringing our total to 7 so far this year. And the cumulative hospitalization rate is higher than the rate observed in week 45 comparatively to every previous season since 2010. So really, if you haven't gotten your flu vaccine already, please go get it. Especially when we're going to be getting together for the holidays, seeing family, and make sure that everybody is protected from the flu. At this point, I think we will turn it over to Julie for our phase 3 updates. And thank you so much, Julie.
Oh, you're welcome. Before I start with the PowerPoints, I just wanted to mention that a lot of these updates that I'm talking about, they're in the Appendix PP. And if you have one of those appendixes and you've looked at them before, they're categorized. You have your F557, let's say that's a dignity and respect tag. You're going to have a big bold sentence for the very first. That's the regulation. And then under that, you have a lot of intent and guidance and purpose, and all of the stuff that's not bolded is what surveyors use to survey. So a lot of these updates and changes that I'm going to be talking about is actually within the intent and the guidance and the procedures that we would use, rather than a change in the regulation wording. So I just wanted to stipulate that when I talk about the updates, it does delve more into the survey side rather than the regulation verbiage. Okay, I hope that makes sense. So go ahead, next slide, please. So what I've done is I've kind of categorize these into regulatory groups. starting with resident rights. This is going to be kind of a snapshot of what the changes are. If somebody has a question, just put it in the chat and I'll try and answer as we go. So in regards to resident rights, there were a couple changes, additions, and language changes. So in 557, which does have to do with dignity and respect, they added language related to mental health and substance abuse throughout the guidance. 561 has to do with self-determination. They reinserted the quote unquote facility policy on resident smoking language because that was inadvertently removed when they did an update before. So they just added that in there. When we go to 563, this has to do with the right to receive or deny visitors. Again, they added language in there related to mental health and substance abuse disorders throughout the guidance, and they added language related to visitation during infectious outbreaks or pandemics. I think what's kind of important for this one, the reason they added the mental health and substance abuse is they're looking for how the facilities are educating their staff to be aware of signs and symptoms of substance abuse, signs and symptoms of overdose, etc. If you have visitors coming in to visit with a resident who actually has a history of substance abuse, and you suspect maybe visitors are bringing something in for them to use. This is where education would come into play, to want to educate your staff on what that would look like if somebody was under the influence and possible OD symptoms. So they added that language in there. In regards to F578, this is about advanced directives. They corrected some tag references. So at the very end of each tag, it'll say, you know, if you suspect this noncompliance, go to this F tag, etc. So it's kind of like a guideline for surveyors. So they just changed a couple of things in that section. In regards to 582, this has to do with Medicaid, Medicare coverage and liability notices. There was a revision that occurred with the skilled nursing facility advanced beneficiary notice process. And so they just updated the verbiage in the guidance and procedures to just update to the new way of doing things. And any questions about resident rights stuff? If not, we can go to the next slide. So we have abuse, neglect, and exploitation. F600, they removed language from sexual abuse, including guidance related to neglect. So this was just verbiage changes, and if there is a resident or residents in the facility that are sexually active, there's ways to assess them to make sure that they are competent enough to have, you know, make consent and things like that. So there was some verbiage changes that happened in that guidance and procedures of F600. F602 and 603 had minor changes or updates to the references. Again, that's just survey geek speak, I would guess, to tell you where to go if you suspected non-compliance in a different area. 604 has to do with physical restraints, and it clarified when a bed rail meets the definition of a physical restraint. There was some gray areas of whether a bed rail is a restraint or not. Most facilities that I have been surveying are very clear in their verbiage on regards to consents, risk and benefits, etc., that bed rails are usually used for bed mobility. That is not a restraint. So I have seen very clear language in our facilities here that, you know, what bed rails are used for and what they're not used for. I think it talks in the clarification, it talks about, you know, if bed rails aren't being used, that doesn't necessarily mean you have to dismantle them off the bed, things like that. So there's just some changes in the way that things are being discussed. 605 has to do with chemical restraints. There were some minor changes to update, again, references and things, nothing that changed the quote unquote regulation piece. And then 606, non-employee staff with adverse actions. This has to do with, hiring staff that don't have any adverse action on their or adverse history, rather. And they revised the intent to match the regulation text is all. So they just did some verbiage changes. That's all. Next
Julie,
slide.
we had a question in
Oh.
the chat box. So
Yes.
the question is, can you please provide some examples of what is not a reportable event under F600 with the new guidance?
What is not a reportable event?
Then Irina, if you want to come off mute and add to that question, if there's anything more that you had, feel free.
Sure, thank you so much. I just wanted to clarify, obviously the CMS regulations did change a little bit in regards to reporting an allegation of abuse with this new ROP. So I was wondering if you can please provide some guidance as to what is not considered to be a reportable allegation. Thank you.
Put me on the spot. Let me see if I can pull up something real quick. Just give me 1 second. We had some training specifically to these changes. So let me see if I can find that for you, okay?
Okay, thanks so much.
Yeah, no worries.
Julie, I also have that question marked down. So if it takes a bit to find the answer, we can go ahead and address it at the beginning of the next webinar.
Yeah,
we can have more detailed. Okay.
Yeah, I might be able to pull something and get back with you, and then you can relay it to the.
Yep, that sounds great. Let's go ahead and continue on. And then Irina, we'll go ahead and reach out to you with the answer from Julie, and then we'll also put it at the beginning of next week's webinar with a question and answers slide.
That's fantastic. Thank you.
Okay, no problem. Next slide, please. For F600, this has to do with abuse policies. They added some guidance for coordination with QAPI and provisions for the former F608. So this has to do with when you do your FRIs, you're reporting any allegations that you're doing your investigation stuff. They took F608 and they relocated it into 607 and 609. So where if there was a hypothetical situation where there was an allegation of abuse and the facility for some reason didn't report it, didn't investigate it, and didn't send a final report before, we would be citing 607, 608, and 609. But now 608 is gone and it's dispersed in between 607 and 609. The regulation requirement and the facility responsibilities have not changed one bit. It's just the regulation itself has been distributed. Does that make sense? So within 607 and 609, they revised the definition and guidance related to timely reports, added language related to what facilities must report, and added provisions for the former 608. So that was probably one of the biggest regulation changes, quote unquote, regulation verbiage changes. So 607 and 609 will be worded a little bit differently. Next slide. So under the regulatory group of admissions, transfers, and discharge rights, there really were no new changes related to phase 3. They did change 622, 623, and 626 guidance in response to feedbacks and questions that they've gotten from stakeholders and other facilities, et cetera. But I don't think anything has changed dramatically in this regulatory group to mention right now. Next slide. So talking about quality of life and quality of care, those are two different regulatory groups. We're going to talk about them together. F675 has to do with quality of life. They removed language suggesting automatic citation of F675 at an IG level. There was some verbiage within our guidance and procedures that was actually kind of confusing for surveyors, and we were having some problems delineating where we should go when we have a quality of life issue. So they just kind of clarified that for us. They added language to direct surveyors to consider impacts to residents. This has to do with what we talked about last week and the psychosocial outcome severity guide, things like that. 686 pressure ulcers, and then 687 was foot care. They changed the guidance to reflect pressure ulcer risk assessments should occur quarterly rather than monthly. There was some verbiage changes there, or whenever there was a change of condition. They also added new language on prior infection prevention practices for foot care equipment, cleaning that equipment, etc. When it comes to 689, which is accidents and supervisions, e-cigarettes has been, or vapes, I guess, have been added to the verbiage. That was not there before, and since it's becoming a prominent thing that we are seeing, they added that new guidance there. This has to do with overseeing their use, including where they're going to smoke them, smoking policies. If your facility, I know most facilities right now are smoke-free, and that includes cigarettes and e-cigarettes. But if for some reason somebody's grandfathered in with e-cigarettes, e-cigarettes should be in the smoking policies. So you might need to update your policies to reflect that. New guidance was added to address safety for residents with substance abuse disorders, and care planning intervention should address the risk for a resident leaving to satisfy an addiction to alcohol or illegal or prescription drugs. Let's see. My screen is kind of cut off, so I'm just making sure from my old slides that I'm not missing anything. Next slide, please. This has to do with quality of life and quality of care still. So we're still under that same regulatory group. 690, bowel bladder incontinence, catheter, urine, UTIs. The regulatory language clarified that this tag is specific for bowel incontinence and not bowel management. I think surveyors were getting confused as to where specific non-compliance needed to go. There were some technical corrections on criteria for initiating antibiotics for UTI. There was a typo within the guidance. It had originally read, for lab work, let's say UTI needed to have a certain lab indicator to initiate antibiotics. It was saying 105 and it should have been 10 to the 5th power. So they just corrected that. F694 has to do with IV fluids. They added guidance on the frequency of assessments of an IV catheter, including factors that affect frequency. They put some new language in there on infection control practices when assessing or using IVs, and clarified the need to document the continued need for IV catheter use. F695 has to do with respiratory trach care, suctioning. There were really no phase 3 regulatory changes, but they did change a little bit of the guidance. They clarified that mechanical ventilation only applies to facilities who choose to offer that service. F697 was pain management. They added language about opioid use and how facilities should assess residents for a history of past addiction and related treatment, and employ strategies to address pain for residents with a history of it. Guidance describes side effects of opioids and addressing prevention of overdose by administering Narcan, etc. Next slide. So last week I mentioned in the psychosocial severity guide, they were talking about this new tag, which is F699, trauma informed care. In the old appendix, they did have 699 there, and they did have the regulatory verbiage, but they had nothing after that in regards to intent, guidance, or procedures on how to survey for it. The new appendix now has all of that content in there. Trauma-informed care is a very specific way of treating residents who have trauma or history of trauma. I'm sure the facilities are familiar with trauma-informed care. If you're not, speak up now and I can speak a little bit to it. My nursing background is all psych. And so I did special training in regards to trauma-informed care. And my last job as a nurse, I was in a inpatient substance abuse and trauma treatment center. So we did a lot of trauma-informed care stuff, but they added, like I said, they added in the interpretive guidance. And it talks about the assessment, care plan, and monitoring, all the key elements that you would have to initiate for the interventions of trauma-informed care. And it talks about, of course, noncompliance, investigative summary, and the deficiency categorizations were added. F700 has to do with bed rails. Clarify the use of bed rails, clarify there were no requirements. Oops. Okay, there you go. There were no requirements that bed rails be removed or disabled when not in use. And they added guidance that if bed rails are determined to be inappropriate for a resident, if left on the bed in a down position, raising that rail would be considered non-compliance. That was added in there. So that's something that surveyors are going to be zeroing in on. If somebody does not have consents, risk and benefits, or it is determined that they don't need it, if those rails are being used, it will be a non-compliance issue. See, under 6, the assessment is not required, correct? I don't understand the question. You want to clarify the question? There was a question in chat that popped up. Arena? No?
Yes, can I please clarify under 699 for trauma-informed care? Is it a regulation to have an assessment complete for trauma-informed care? Did they update the interpretive guidance on that, or can we just have the care plan and the history for trauma-informed care?
I think that, you know, if you're getting a history of it, that's the start of an assessment, right? If you're, let me get to it so I can make sure I get the right verbiage for you guys. There has to be an assessment if there's any trauma for residents that you guys are housing in your facilities.
I believe, from what I understood, the assessment was not required, only the care plan and the history or notes. If you can just clarify that, please, maybe for next call, that would be great.
Okay, I will do that. Absolutely.
Thank you so much.
Yep, no worries. Next slide, please. For physician services, there is a table under F712 that helps determine when physicians should visit, their timeliness, their need to sign orders, make notes, etc. They separated out of some columns that were put together originally in the same column. So they just kind of made the table a little bit more easy to read. In column 2, it previously contained the initial comprehensive visit and administration orders, and those have been split out into 2 separate columns. Column 4, signing orders, has been added to each of the rows for clarity, and then column 6 talks about as permitted by state laws. So I'm not going to go too much into that table, but you guys can look at that separately. Next slide. Nursing services. So all the regs that you see on the PowerPoint, all of them have had additions to their guidance for the procedures, probes, and or deficiency categorization examples. So this is just more survey geek speak, but it does just clarify things for us on the survey side. Next slide. Behavioral services. F740 has to do with behavioral health services. It removed references, added references, and is adding reference to the psychosocial severity guide. It added language related to mental health and substance abuse disorders. F741, same revisions for this one that were talked about above. It also added language related to history of trauma and or PTSD, and added language related to mental health and substance abuse. F742, 743, 744, All of them, again, reference changes. They added some references to the psychosocial severity guide. Next slide. This has to do with pharmacy. And so pharmacy services, it clarified language related to disposal of fentanyl patches. This has been an issue I think that's been coming up. Normally, let's just say like a nicotine patch, you would fold it in half and you'd throw it away. Can't do that with fentanyl patches. It's still considered a controlled substance, and there have been issues with residents actually ODing from fentanyl patches they've been fishing out of the garbage and chewing on them. Things like that. So they put some language in there to clarify. 757 has to do with drug regimen being free from unnecessary drugs. They added language related to antibiotic stewardship and F881. And then 758, this has to do with psychotropic medication and PRN use, clarification of other classes of drugs not listed in the regulation and how they are affected by the psychotropic medication requirements. And they added language on potential misdiagnoses, such as diagnosing somebody with schizophrenia in order to give them an antipsychotic. So there's some verbiage changes there. Next slide. And then we have QAPI. So 865 is the QAPI program. Disclosures and good faith attempt. Phase 3 requirements laid out in this requirement. It requires the facility to have the QAPI program. So it's just more verbiage about laying out what that means and how to survey for it. F886 has been relocated into F867. So there's no more F866. It's just been folded into 867. The phase 3 requirements for 867 actually came into effect in November of 19. So there's not really nothing too much new there. I think it's facilities have already initiated these changes. 868, this is the Quality Assurance Committee, and now identifies the infection preventionists as a required member of the Quality Assurance Committees. And then F944 has to do with QAPI training. And this is just a reminder that QAPI training has to be mandatory for all of your nursing staff. I believe staff in general needs to have some QAPI training. Next slide. These are some tags that didn't really fall under any of the other regulatory groups, but I wanted to mention them. All the training tags from F940 to F949, they added some new guidance throughout each of those tags, talking about what's required, what's mandatory as far as training goes. 656 has to do with the comprehensive care plans. They added some new requirements that care plans should include culturally competent and trauma-informed information. This has to do with your problems, your goals, your interventions, or approaches that you're using in regards to individualized care planning. F812, this has to do with kitchen, food procurement, storage, preparation service, etc. The guide was reorganized for clarification. Things just were shuffled around a little bit. They did add some language related to cultural changes in dining practices. Infection control, which is your F880 through 883. Those additions were actually in effect, have been in effect since November of 2019. So there wasn't much to really discuss there. F847 and 848, this is your binding arbitrary agreements and your arbitrary venue selection and retention agreements. Those came in effect in September of 2019. So I really don't think that there's much to go through here. And then you have your 895, which is your compliance and ethics program, which came in effect in November of 2019. It's kind of a quick little picture of each of those regulation changes. Is there anything that I can address immediately or that I can bring up right now? I know there's a couple questions I need to follow up with. No? that's all my presentation then. I hope that was helpful, at least a little bit.
Thanks, Julie. I just want to let you all know that Julie has graciously offered to come back and go more in depth in any of these sections if the group feels that they need a little bit more clarification or a little more in-depth detail. So do keep that in mind. And if you do find something, go ahead and let us know, and we can always reach back out to Julie and ask her back. If there's not any questions, I don't see anything coming up in chat, nobody came off mute, then we'll go ahead and let you go. We want to thank everybody for joining us, and we will be back next week on the 30th with It's Worth a Shot. So happy Thanksgiving to everybody, and I hope you enjoy the holidays and your family, and we will see you next week. Thank you.
Thank you.